Alabama's weekly Global Perspectives Institute. We have thought about the topic of COVID-19 for several months, given the impact that it's having on our communities. We weren't sure what focus we should have, and then in our research of local and other resources, we realized that we had a very special visitor with us last November. She was part of a Hidden No More delegation of female STEM leaders from around the world. And we said, she's a physician. We wonder how COVID is impacting her and her communities in Nigeria. And then just a few weeks ago, one of my board members was telling me about his wife who was part of a vaccine research project. And all of this started to come together. It was also the timing that we were really pleased about, because our moderator, who has a podcast, announced that his focus for the next 3 episodes would be on COVID-19. So there it was. We didn't have to search anymore for a specific focus. So I'm delighted today to present to you our moderator, David Person. I consider David a global citizen. He's a long-term journalist, both in print and radio. He's hosted talk shows and is now leading a podcast that many of us are familiar with, Healthy Alabama. He's also a consultant with numerous organizations throughout the state of Alabama. And most recently, and I just got to see it on Sunday, if you pass the Mid-City complex, you will see a beautiful mural of Little Richard. And many of us know that this global gospel singer had a lot of connections to the Tennessee Valley here in Huntsville, especially because of his attending Oakwood University. Most important, though, is that David is one of Global Ties Alabama's distinguished citizen diplomats. He represented the U.S. in a reverse exchange with the Young Leaders of Americas, I think in 2017. And he meets with our delegations all of the time. And so I'm just delighted that he took time to be with us today as the moderator of our discussion, Africa to America, a global conversation on COVID-19. David, I'll turn it over to you.
Thanks, Jackie. And I want to say good afternoon, or depending on where you are, good morning to everyone who's with us on this Zoom. And I know there will be others who will see this after we complete it, thanks to technology. And I want to thank Jackie. Thank you for this invitation to be part of the Global Perspectives Institute series that Global Ties Alabama is doing. And I think this is a great topic, from Africa to America, a global conversation about COVID-19. So I want to introduce our 2 experts, because as he has said, I'm a media consultant, media personality here in North Alabama and beyond. My expertise is not medical. So I'm glad that we have 2 experts here. One who is coming to us all the way from Nigeria, Dr. Amola Salako. She is a clinical oncologist and physician there. And she also lectures at the University of Lagos. And she has several medical practices and businesses that she is involved with as a social entrepreneur. That's how she describes herself. And I think that's a great description. Dr. Salako, thank you for joining us today.
Thank you.
Also, we have with us Tanya Pryor, who is based here in North Alabama And Tanya is the co-owner and senior research director at two premier research facilities here in North Alabama. Both these, I think the names, and Tanya, help me out here, the names are Medical Affiliated Research and North Alabama Research. Is that right?
That's right. That's right.
Okay, great, great. So both of these clinics are multi-specialty research sites that specialize in many areas of therapeutic research. Tanya's background is as a registered nurse. She's worked in hospitals throughout the Southeast. And Tanya, we want to welcome you as well.
Thank you. Thank you very much.
All right. We're going to start with Dr. Salako. So Dr. Salako, you are based in Lagos, is that correct?
Correct.
Okay. Tell us a little bit about well,
the second thing is, yes, the government, that's the Center for Disease Control, has launched a very aggressive effort to control COVID. And the third thing is, I think it's the grace we have in the country, maybe down to our genetics, down to our genetic buildup that is protective, that is intrinsically protecting us from the COVID or sort of mutating into a less aggressive strain. So it's a combination of different factors for our low numbers.
Dr. Salako, before I move to Tanya, I want to follow up on what you just said. That third part, you said, I think you called it the grace of genetics or something to that effect. Explain a little bit further what you mean by that.
Okay, so for example, in Nigeria, malaria is endemic. We have 9 in 10 Nigerians have malaria parasites in their bloodstream, and they're not going to come down with malaria. We have certain infectious parasitic agents that are just within the body, and somehow we have built up our immunity, our immune response to this agents. It is possible that so when these flus, these viruses come into our system, it is possible that we are able to defend, or our immune system is able to fight off these infections way better, because the immune system of Nigerians is constantly fighting P. falciparum, some bacterial infection, and finds a way of building resilience to novel viruses. Again, it's a hypothesis, but there's something in there.
Tanya, please unmute yourself. I want to ask you some questions now. And thank you, Dr. Salako. That we're off to a very interesting start with what you've shared with us. Tanya, as you listen to what Dr. Salako has talked about, you're here on the front lines in Alabama. What's your reaction to what you've heard so far?
I think it's scary times, and I think that the grace of genetics, I haven't heard, and that's pretty interesting and exactly right. I think that here in Alabama, we are seeing lower numbers for the spread of COVID, but I definitely think that it's related to the measures that we're taking, masking. People, I think, are really understanding how important that is. And initially, people in the United States were definitely not thinking that masks were necessary. And I think the CDC even came out early on and said masks aren't necessary for the normal, everyday activities that you do, which I couldn't believe they were saying way back then. Just common sense says that, you're not going to spread things more rapidly, if you have a mask on. So I feel like that most people, at least in our area, are wearing masks and feel comfortable. Definitely feeling, I know with me at work in the clinic, I definitely have to have mask breaks. The claustrophobia that you feel, and then you get hot, and it's definitely something to get used to, but I'm definitely seeing more people receptive to the vaccine trial that we have. At first, when we were putting the word out, it was a little difficult. We were getting some people who like to share their opinion on social media, whether for or against vaccines, just in general. So, I mean, the trial is voluntary, so we just let those people talk. And but yeah, we have, let's see, in our clinic in Huntsville, we have about 300, maybe 320, somewhere in there enrolled. And then we have about 380, sorry, here in Athens. So we're definitely seeing some good numbers for the sponsor that we're working for. So we're excited. Yeah.
Mhm. So there's a little bit to dissect there with what you said. I want to start with your belief about the number of cases. It does appear, I'm looking now at a chart that says that that there does seem to be, despite some spikes between July and September, there's been an overall decline in the number of daily cases. The last numbers that we've seen, or at least that I see here on this chart, indicate that as of the 26th of September, we had 933 reported cases on that day, 933 new cases. Does that figure sound right to you?
It does, yes. I think that if we had not adopted the masking policy, at least in Alabama, those numbers, I don't think that they could have declined naturally, not without other barriers. And we just, until we get the vaccine out, whatever company comes out, I've read where it's late October, early November, which seems reasonable, but maybe a little bit of a stretch, but definitely is possible. That'd be great. We are hoping that it's with Pfizer, who we're in partnership with, but whoever it is, whoever's a little bit ahead, it will be definitely an exciting time for people to get out and about once their immunity gets built. So.
Sure. We're gonna come back to that vaccine question in a minute, but I
Sure.
want to also, before we get to that, I want to discuss briefly the unique challenge that I think we face here in the United States. I don't get the sense, and correct me if I'm wrong, from your vantage point, but I don't get the sense that COVID-19 has been so dramatically intertwined with politics in any other nation of the world other than this one.
I
And I
agree.
think that's been due to the very aggressively adversarial position that the President of the United States has taken related, this is all documented. This is not
Sure.
about partisanship. This is documented,
Yeah.
related to the threat of the disease, the response to the disease as it relates specifically to masks, and there even seems to be some bureaucratic tension that I think has been fomented, at least in part, by the attitude of the President of the United States. What other difficulties would you say? Well, first of all, do you agree with what I've just said? And then
100%.
secondly,
Yeah.
okay. And then secondly, what other challenges do you think we have been facing here in the United States as it relates to trying to limit the spread of COVID?
Yes. So I feel that you're right. It was wearing a mask was almost, I know people would even say it on our social media pages, a political statement, which is absurd. I mean, it is a it's respect. You may have COVID and not know, so you wear the mask as a sign of respect so that you don't spread it to people who, might be compromised in other ways. But so yes, definitely. And then in the US, we love to get together. We love to have, the ball games and different activities that all of our young kids are involved in. And even, Huntsville started the minor leagues baseball that they had. So just all of those examples, it just makes it very difficult to continue as normally how we would. So, but the masks have definitely made it easier. And I feel even just with me going out and about, I feel more relaxed. But yes, definitely barriers. And I think you're right, politics kind of weighed in when maybe they shouldn't in a lot of ways. So.
We're going to come back to vaccines in a minute, but Dr.
Okay.
Salako, I want to bring you in for just a moment to ask you just again, so we can get a truly or get as global a perspective in line with our presenting institute here today about what the atmosphere is politically as it relates to COVID. So we've talked about the political challenges here in the United States. Have there been any political challenges in Nigeria in terms of addressing this horrible virus and what it does to populations?
Largely, I would say no. We've had a united front, and I'm speaking to the political parties in Nigeria. There's been no obvious, and I say obvious, very intentional. There's been no obvious political agenda with the COVID thing. The major issue for us was as the people of Nigeria not trusting the government. So when the government came out and said COVID is real, the people said, no, you're lying. You found something to lie about and make money out of, and you want to deceive us. There's an agenda behind the COVID. So the people, we continue to struggle with the people trusting the government. And when the government comes out to say, oh, A, then the people go this way. So I would say that's the sort of problem we had.
Okay, all right. So a little bit different, not so much about partisanship, but just more about trust, and integrity, or perceptions of integrity. Okay, let's talk about vaccines and vaccinations. And I'm going to start with you, Dr. Salako. You heard Tanya say that she's got about 700 people, I think if I did the math correctly, roughly 700 people who are who are in the vaccine trials with her two clinics, facilities here in North Alabama. What's the latest in terms of the vaccine testing in Nigeria, or is it even happening in Nigeria?
Oh yes, it is. It is happening. So we've got clinical trials, and I'll start with herbal medications. So there's the complementary aspect where our medical research institutes like Nigerian Institute of Medical Research, they're sort of anchoring clinical trials on complementary medications that can boost the immune system or can be used to treat COVID. And then there's the vaccines, and we have several clinical trials going on in different parts of the country. Pharmaceuticals like Pfizer are in Nigeria and are testing. And some of the clinical trials, there are multiple, have scaled through phase 2 and some are in phase 3. Just as Tonya said, some are promising that we would have a vaccine out by Q4 this year, hopefully. So yes, I would say, yes, we do have clinical trials. Nigeria is actively recruiting participants from all parts of Nigeria.
So I know that, well, let me start here. I'm going to start from a fictional place and move back into reality. Some years ago, there was a movie that was produced called The Constant Gardener. And this movie was about the manipulation of specifically of African populations by pharmaceuticals, Western pharmaceutical companies. I would assume that if there is still a concern about that on the African continent, that when you couple that with the challenges that people apparently have in believing the government, that there would be some resistance, some fear, some suspicion of the whole vaccine, the clinical trials and the vaccine process. What do you say to that?
Okay, so I'll start with a fictional response. So the information out there initially was, if you take this vaccine, you're going to become a zombie, and a lot of people are like, oh, no to vaccine. And the West is trying to track us using the vaccines. They're trying to put some sensors, that, a whole lot of things around that. But Africa is maturing. Africa is producing not just intellects that are intelligent, but they also have integrity. So as long as our research leaders, the healthcare institutes have the right leaders who understand the ethics of conducting research, they understand beneficence, the principles that guide ethical research, we should not run into those problems. And in Nigeria, our institutes, we are blessed, and I will say we are blessed to have people in the Ministry of Health in Lagos State, in Abuja, and all across Nigeria who are spearheading this research and ensuring that Nigerians are not being taken for granted, or samples are not being used in the wrong way. And so, yes, there's that fear, but we also I have the assurance that the guys who are leading the research on the COVID know their stuff. They're the best in the country on the global stage. They understand what it means to conduct ethical research, and they can protect us from big pharmas or any corrupt individual.
Okay. Well, that's well said. Now, just to be clear, I wasn't suggesting that suspicion or challenges related to getting people to believe in vaccination was unique to Nigeria. That's a widespread concern here. Tanya, jump in. That's a widespread concern here. In fact, for many African American people, because of the history of medical testing on Black people without their permission that goes back to the 1920s and 30s here, and forced sterilization of Black women that has taken place and been documented, again, without their permission. There is and then also let me add, recent studies about the high level, the high impact of racism and racial bias on healthcare in this country, which has been documented by respected researchers like Dr. David Williams of Harvard University and Dr. Ron Wyatt. This is something that I think is also widespread and prevalent at least in the Black community. Tanya, I mean, what's your analysis of this?
I definitely agree. When we decided to do a vaccine trial, regardless of what company we decided to go with, we knew that would be a huge challenge. We knew there were definite trust issues, just like she was saying that I feel like the African American community has rightly feels the way they do, and I would feel the same way. I mean, we knew that would be an issue, so we tried. Since we've been here for almost 12 years, so we've tried not just with this vaccine trial, but with other trials to build that relationship with the African American community, and I feel like we have in a lot of ways. We have several who participate in other trials that we have that are ongoing, and we've had a pretty good percent to volunteer for this trial also. The focus now with Pfizer is to, I think their word is people of color. So they're the last few thousand in the United States, they want the people of color, whether that be African American or Hispanic. So yes, I definitely see where there's a mistrust for sure. And it's just, that's going to take time. It's going to take a lot of time and you know, relationship building with each individual clinic, I believe. Maybe that'll help. I don't know.
Yeah, well, I would assume that relationships, personal relationships,
Yes.
over time will make a difference and help to mitigate some of that.
Yes.
One thing I'll say before we open this up for questions is that I know I've been told by other people who are in this clinical research space that there is there's an absolute need to ensure that African Americans and other people of color are included in these clinical trials to make sure that the vaccines will work, quite
Right.
frankly, on people of color.
Mhm.
So it's a very interesting sort of dilemma that we face.
Yeah.
Okay, so I'm told that we've got about 20 to 22 people on the line with us, and I'm sure I'm not the only one who has questions. So I'm going to open it up now. You can either, and Jackie, I'll probably need some help with this, but we can either take questions via the chat, or if someone just wants to jump in, and I'm going to try to open up my screen here so I can see as many of you as possible. If someone wants to, you know, raise a question audibly or visibly so that we can see you. You don't have to show yourself, but if you want to do it either way, either of those three ways, we'll be glad to take your questions at this time.
Great. And I'm here to help if you need me.
Thanks, Jackie. So do we have any folks out there with questions for either Dr. Salako or for Tanya Pryor? Okay, I see a raised hand. Yes,
Jay
ma'am.
Davis.
Hey.
I wanted to say hi to Dr. Lola. I met her last year. And I'm participating in Tanya's study, myself and my middle son. And it's all I can do. I can't go out in March or do anything and register to vote people, but I can at least take part. And it's good to see you.
Good to see you
Stay
too.
there.
Good to see you too. Beautiful, beautiful. Does anybody else have a question at this time? I mean, I can ask questions for another 30 minutes if you want, but I'm sure you'd rather jump in with your own questions, so feel free.
Yeah, David, this is Kenny Anderson.
Hey.
Hey, what's happening, man? Just want to say that I'm happy to be a part of this conversation today, to the facilitator, Jackie, and also to the guest panelists. I appreciate the information that you shared thus far. My question is, everyone talks about a post-COVID era, and all of us anticipate being on the other side of this pandemic at some point. We're learning through this process, hopefully, about things that we'll be able to apply post-COVID. So from a medical perspective, as you think about the challenges that we're facing as it relates to health disparities, access to health education, and even access to basic care, what are the lessons that we're learning that you see we're learning right now that we'll be able to apply in a post-COVID era as it relates to healthcare?
Great question, Kenny. Tanya Pryor or Dr. Salako, whoever wants to jump in, feel free.
I think we're learning a lot of lessons, as he talked about, and I think that we as a society are going to have that post-COVID attitude and maybe change some of our infection control practices in the hospitals and out. Definitely it will be challenging, and then even if a vaccine does come out fourth quarter, who's to say it's going to work for a year or two, or I mean, they're hoping a year. I know we follow our patients for 2, It's just a lot of unknown, I think, which can be scary, and people definitely react in different ways when they're scared and nervous about what's going on in our society, for sure.
Dr. Salako?
And so for us in Nigeria, our healthcare system has always been overwhelmed with so many patients per healthcare professionals. And so it's been a wake-up call, and the healthcare system was just exposed 100%, and it showed how weak our healthcare system was and the sort of care the masses in Nigeria were receiving. And so it's been a wake-up call to our leaders, Nigeria, to invest in healthcare. The second thing is it also exposed how hard healthcare professionals in the country are working and the conditions they work in. And it just became glaring the reason why we have the exodus from Nigeria outside, having trained nurses, doctors, and then they just graduate and move on to other countries. So it's been a wake-up call for healthcare professionals to take care of themselves and stand up for their rights and stop putting up with a weak healthcare system and speak out. And it's also been a call to the private sector and the government to invest in Nigeria, because during the COVID, no one could travel abroad. Everyone who got COVID, who was rich, who had a private jet, could not travel abroad. So we have to build our system from within. And we're seeing some improvement, but we should have achieved more by now. But at least we have that wake-up call to build our healthcare system.
What's the situation with PPEs over there?
Oh, scarcity. Scarcity right from the beginning. We knew we don't produce anything. We don't even produce a pencil. So we were largely dependent. We had to import everything, and because there was everything was shut down, so we couldn't bring in things as fast. And as usual, the healthcare professionals had to compromise and go in to do the work in the absence of PPEs. And in some isolation centers, half of the patients in those isolation centers were healthcare professionals, because they had put themselves right at the front line without the adequate PPEs, and they had to make that choice of treating or abandoning their work because they don't have PPEs. So we faced a lot of scarcity right from the beginning up until now. And a lot of healthcare professionals are, yes, we do have support, but it was just not enough while the fight was on.
We've talked a lot about Nigeria. I don't know how much you're able to monitor what's going on in other African nations like South Africa or Egypt or Kenya, some of the other larger nations that often pop up in global conversations or geopolitical conversations. But just share whatever you can. I mean, whatever your assessment is of how these other some of these other nations are dealing with COVID or being impacted by it.
Well, I can speak to the fact that in the last few weeks, some countries, some parts of Africa, like West Africa, Ghana, have started to record a decline in new cases, while places like South Africa, which accounts for the country with the highest incidence and mortality from COVID, they continue to record higher cases. Again, across Africa, the death rate from COVID is still quite low compared to other continents. That's much I could speak to other countries.
Okay.
David, I have a question.
Yes.
I have one for Tanya and then a follow-up with Dr. Omo. Tanya, you had mentioned earlier that your partner Pfizer had some requirements regarding the diversity of participants in the vaccine process. Can you talk a little bit about that?
So initially their goal was 30,000 participants US wide. And so at both sites, we had to give a percentage of what we thought we would be able to enroll out of those 300 at each places, the different, ethnic groups. So we shot low and then aimed high, I guess. But they have closed the normal enrollment for us, that we could just really enroll anyone that wanted to participate. It was not hard to get enrolled in the study. There weren't a lot of inclusion, exclusion issues, but now that has been put on hold about a week, and we were to focus on other ways of reaching those people of color. So we have connections with the different communities here in Athens and in Huntsville. So we've reached out and we've been successful. But those are the people who are willing to volunteer are the ones that we have had relationship with in the past. I mean, people are not going to walk in off the street and just to get information and want to enroll, so we're definitely seeing that. But we've always wanted to build relationships in the communities that we're in, so it was a little bit easier for us. And now I think that their numbers, I think the total, they want 44,000. So more, total instead of 30. So I think those additional will be the different ethnic groups from what I understand.
So what percentage do you think are just ballpark percentage of people of color who are enrolled?
Let's see. Probably for Athens, we are maybe 10%, maybe a little higher, actually. I haven't ran those numbers in a little bit. Mm-hmm. And then Huntsville, I do believe we're higher. We're probably around 15 or so. Yeah. Okay. So it's still on the low side, but a little bit.
Good. Dr. Omo, because you were part of the Hidden No More STEM delegation, finding females around the world who were STEM leaders, has this COVID impacted the drive to find more young women to engage in medical and healthcare professions?
Absolutely. So the Hidden No More program last year was phenomenal. I enjoyed my time, especially in Alabama. I got to see Santa Claus, real Santa Claus for the first time. And he came early in November. And shortly getting back to Lagos last year, I just had so many ideas that I had not implemented or I didn't take seriously. And being at Huntsville and the many cities I went to was a wake-up call for me to just get going with all of my projects. One of which is the X Labs, which is a platform that educates and finds young healthcare professionals, especially people in the cancer space. Something else that one of my ideas I brought to life was the Oncopadi mobile cancer app, which is the first cancer app in Nigeria, and it connects cancer patients to cancer specialists, to survivors, to practical tools, to information. And I just had everything trapped right there in my head, but I needed that Zen space. I needed to see other women like me from other parts of the world. And since then, it's just been, 2020 has been a year of implementation. Even COVID could not stop those ideas. And so beyond the program with the girls, with the doctors, there are many other things I have launched with various people, along with my hidden no more participants. Like I'm working on different projects with other participants. So I want to say thank you to the Hidden No More crew that took us around 4 cities last year. I want to say thank you to John Davis. I'm sorry, I don't recollect your name, but I'm not sure if that's your name.
Jane, his wife Jane, yes.
Yeah, so thank you so much for the time. And Jacqueline, you were phenomenal. Thank you for the opportunity to.
Great.
Beautiful. So before we get to some concluding remarks, I want to ask Dr. Salako about what you've seen as an oncologist who also is looking closely and studying and working in this area of COVID, responding to COVID and helping to try to prevent COVID. Is there anything notable that you have seen where cancer patients or cancer issues overlap with COVID patients or COVID issues?
Oh, yes. So very early on during the pandemic, all the hospitals shut down and cancer patients could not access care, as well as there was just no transportation, public transport for patients to fly, as well as there was a rigid curfew where patients had to go through several police stops to get to where they were going to. And if they successfully did that, cost of transportation was ×3. So during the COVID, the first 3 months, cancer patients faced a lot of hardship. They could not access care. Secondly, patients who presented with symptoms of spread to the lungs, maybe they were coughing or they had this heaviness in their chest, it was quickly identified as COVID. So patients were not being treated optimally for the fear of COVID, as well as patients were just generally scared to come into the clinic, especially when we recorded the first death due to COVID was that of a cancer patient. So I would say research backs it that people with comorbidities have a higher risk of being very ill. And that we've seen in Nigeria. Secondly, the fear of COVID is real amongst cancer patients. They see the hospitals as a source of COVID transmission or infection, so they avoided it. And then the hospitals were shut down, so there was really no access to care. But in the last 3 months, most of the cancer hospitals have reopened. Service has returned back to normal. And we've lost a lot of cancer patients due to the fact that they didn't access care in the first instance. And their quality of life was very poor because they didn't have access to treatment. And on the other hand, because I work in the telemedicine space for cancer patients, there was a rush online where cancer patients and their caregivers were frustrated and were coming online to search for help. And through video consultations, we were able to navigate them in between all of the complexities of the lockdown. And so I would say that things are back to normal, almost back to normal in terms of access to the cancer hospitals for patients. Beyond that, we've always had traditional issues that cancer patients face. They can't afford care. There are not enough cancer centers. There are just 100 oncologists in the country. So the cancer ecosystem already has its complications that just got complicated by COVID. But we're returning back to normal. And apps like Oncopadi have emerged because the COVID pandemic just left a huge gap.
Okay. Well, we've got less than 10 minutes left for this program today, this Zoom conversation today. So I want to give each of you a chance to make any kind of concluding remarks that you feel need to be made, anything that we may have missed that I should have brought up that you think needs to be brought up. And Tanya, I'm gonna go ahead and start with you, and then we'll let Dr. Salako close it out. Go ahead, Tanya.
David, before Tanya begins, may I just remind everyone that our Global Perspectives Institutes are a little different. They are not 1 hour, they are 45 minutes. So if we could take 5 minutes to close off, we're just trying to be sensitive to those who are normally on. This conversation could go on, and we'll probably end up having a part 2. But in the meantime, if we could do the closing remarks in 5 minutes, that would be great.
Thanks, Jackie. Sorry about that.
No problem, not a problem.
Well, that works out because I didn't really have much more to say, except, I'm ready to get back to normal. I'm excited to be in research, and more excited that we were able to get a COVID trial. And I hope somebody comes out with one. I hope it's ours, because I would love to see our patients. I think they would be really excited to be part of it. So I know that they feel like they're making a difference, and we do too. It's definitely rewarding. So thank you for having me.
Awesome. Dr. Salako.
It'll just be a reminder for us all to do what is right, which is to wear our masks, observe social distancing, and really to check up on our loved ones, because the COVID pandemic has sort of brought a new type of depression that we have experienced in Nigeria, being locked up at home, not seeing loved ones. So I would say reaching out to people, friends, family, and stay safe.
Great. Dr. Salako, Tanya Pryor, thank you for your great answers to our questions today. Very detailed and I think very informative. And I see that our fearless leader, Jackie Shipe, has a great mask on that I really fully support and endorse. So Jackie, thank you for this opportunity that we've had to come together today.
Thanks to everyone who has joined us. Last week was voter registration day, and that process has just a few more days left to it. So I want to encourage everyone to vote, and also to extend to you an invitation to join us next Tuesday, same time, 1 o'clock, for our 55th anniversary. Global Ties Alabama will be celebrating 55 years. Our theme is Lifting Global Voices Through Citizen Diplomacy, and we hope that you'll be able to join us. Thank you so much, Dr. Omo and Tanya, for joining us. Thank you, Jane Davis, for recognizing that if you can't march, you can donate through the vaccine process. To all of you on our call, we really appreciate you. David, thank you for your excellent moderating skills and expertise. We look forward to seeing you and working with you as we move forward in our community. Thank you so much and have a great day.
All right. Bye-bye.